So what we're about to do is to treat scar formation on the right side of the face. And this scar is from many years ago, but still with lasers today, we can make a dramatic change in scar formation. We're going to use a couple of different things to make this scar better. Number one, a laser called an ablative laser, or the Fraxel Repair, which is an aggressive laser to try to reduce the thickness of this tissue. The second thing we're going to do is going to use a topical steroid, which is to go through the skin surface, because the laser is going to give us little channels. And this is a formation we call laser assisted drug delivery, or LADD. The last thing that's been shown to be helpful is slowing down the motion over here as the body is stimulating new collagen. You can see these muscles are beating the skin up. So as the skin is healing, if we slow it down with a little bit of Botox, it's going to help improve the outcome. The last thing, using small amounts of Botox right directly into the scar is helpful in reducing scar. So we're using a laser, we're using a topical injectable steroid, we're using Botox. And that's what we call synergy, where 3 different approaches done all at the same time yields a better result.